Assalamu alaikum wa rahmatullahi wa barakatuh. In this lecture, we will learn about cephalometric points and landmarks, mainly the anatomical landmarks of hard tissue and soft tissues. The first landmark is sella. It is the center of the hypophyseal fossa. You can see in the picture the number 1, the central dot in the hypophyseal fossa is the sella. Number 2 is the nasion. In short form, we write N. Sometimes we write Na. The intersection of the internal nasal suture with the nasofrontal suture in the mid-sagittal plane. You can see in the picture the depression point with the nasal bone and frontal bone in the cephalometric tracing number 2. Number 3, porion. The midpoint on the upper edge of the external auditory meatus. There are 2 porion, mechanical and anatomical porion. Based on software you are using, you need to decide which porion you will select. Usually we do the anatomical porion, that is number 3. Here you can see mechanical porion and anatomical porion in the picture. Next point is orbitally. Orbitally, the lowest point on the lower margin of the bony point. If you see the orbital lateral line, the lowest point marked in the tracing number 4. So that is orbitally, the red arrow showing orbitally. Number 5, pterygomaxillary fissure, PTM. Some tracing we don't draw, some tracing we draw this PTM. You can see in the picture it is crystal clear and marked with number 5. The blue arrow is showing PTM. Number 6, articulary, short form AR. It's a cephalometric landmark defined as the intersection of the posterior border of mandibular ramus and the inferior contour of the posterior cranial base in the occipital bone. Number 7, Bayesian, the lowermost point on the anterior margin of the foramen magnum. In the tracing you can see number 7 and skull view also you can see the number 7, Bayesian. Posterior nasal spine. The tip of the posterior spine of the palatine bone in the hard palate is posterior nasal spine, marked with number 8 and the blue arrow showing the PNS, posterior nasal spine. Anterior nasal spine marked with number 9, the most anterior point on the maxilla at the level of the palate. You can see the blue arrow showing the ANS, anterior nasal spine. Number 10, superior spinally or point A, the deepest midline point on the premaxilla between ANS and superior prosteum. That is number 10, you can see the deepest point. Number 11 is superior prosteum or supradentally. It is the most anterior inferior point on the maxillary alveolar process, usually found near the cemento-enamel junction of the maxillary central incisor. You can see the blue arrow showing the superior prosteum. Next one is molar point. Molar point is defined as the mesial contact point of the crown of the maxillary or mandibular first permanent molar. In the tracing, it is showing in a red dot with yellow circle. Next point, inferior prosteum or infradentally. It is the most anterior inferior point on the mandibular alveolar process, usually found near the cemento-enamel junction of the mandibular central incisor. The blue arrow showing the inferior prosteum or infradentally. Supramentally or point B, the most posterior point in the concavity of infradentally and pogonium. It is the deepest point actually. Here the blue arrow showing the point B. Pogonium most anterior in the contour of the chin. So the blue arrow showing the pogonium. Gnathian, the most anterior inferior point on the contour of the chin. It is easy to decide between pogonium and menton. The midpoint is the gnathian. So here is the gnathian. Menton, the lowermost point on the symphysial outline on the chin. So this is the menton. So menton, pogonium, in between gnathian. This is gonium, most posterior inferior point at the angle of the mandible. It is the bisecting of the angle formed by the mandibular and ramal plane. In my next lecture, I will discuss about the planes. So it is crystal clear shown by red dot, the gonium. Cephalometric points, hard tissue landmarks are discussed. Now the soft tissue landmarks. Number 1, glabella, marked 21. Soft tissue landmark defined as the most prominent point on the midline of the forehead, situated between the eyebrows and just above the underlying bony glabella. So here you can see it is crystal clear, marked with 21. Soft tissue nasion. Hard tissue nasion is different. Soft tissue nasion, the point greatest concavity or deepest indentation in the soft tissue profile, located between the forehead and the bridge of the nose. 22. Marked. Pronasally, PRN, short form, the most anterior and prominent point on the tip of the nose is the pronasally, marked 23. Subnasally, the point where the nasal septum merges with the upper cutaneous lip in the mid-sagittal plane, midline plane. You can see it is marked 24. Next one, labialis superior or labial superius is a soft tissue landmark defined as the most anterior point on the contour of the upper lip's vermilion border in the mid-sagittal midline plane. It is showing on cephalometry with the E line. As I mentioned, next we will discuss about the line and plane. So the red dot is showing the labialis superior. Stomion refers to two soft tissue landmarks that represent the point of contact between upper and lower lips. Number 26. Labiali inferius is a soft tissue landmark defined as the most anterior point on the contour of the lower lip, vermilion border, as viewed in the mid-sagittal plane. That is labialis inferior. Next one, soft tissue pogonium. There is hard tissue pogonium also. So this one, soft tissue pogonium, the most prominent point on the contour of the soft tissue chin in the mid-sagittal plane. With that, thank you very much. We learned anatomical landmark. Next, we will learn cephalometric plane. Assalamu alaikum wa rahmatullahi wa barakatuh.